Hello, and thank you for joining us on the Stay Healthy Knoxville podcast, brought to you by Simply Physio, aimed at helping you live an enjoyable, fit, and healthy life in and around our community of Knoxville, Tennessee. And now, here is your host, Dr. John Mark Chesney.
Hey guys, welcome to Stay Healthy Knoxville and our episode. Today, I'm super excited about our guest. We have Dr. Joe White. He is joining us. He is originally from Cincinnati, Ohio, but spent most of his life in Florida. And he is a local ENT physician. He's earned his undergraduate and medical degree at the University of South Florida, and then went on to do his residency at Southern Illinois School of Medicine. Dr. White knew from the beginning of his medical journey that he wanted to work in surgery. He was especially attracted by the instruments and tools involved in ENT. He has a special interest in the management of sleep apnea, which we're going to talk about in detail on the episode here today, as well as sinusitis and chronic sinus diseases. Dr. White is trained in transoral robotic surgery, which is something that can be performed for sleep apnea and also other advanced sleep apnea surgeries. When he's not working, he's enjoying outdoors, mountain biking, kayaking, soccer, backpacking, traveling. We actually had to reschedule one of our original podcasts because of a golden retriever event. So he has 2 golden retrievers as well. So Dr. Joe White, welcome to Stay Healthy Knoxville.
Well, thank you. I really appreciate being here. I'm glad that I can be a part of this. I think this is a great service that you give to Knoxville, and I look forward to talking to you today.
Yeah, awesome. Well, I love to start with each of our guests to really just understand, particularly with you, getting into medicine. What drew you into medicine? Kind of take us back.
Yeah, so I wish I had a very interesting kind of Marvel origin story, but it's not that interesting. So basically, I wanted to be a doctor ever since I can remember. And my mom would tell you that since 6 months old, I wanted to be a doctor. And so that's kind of what I did. I became a doctor because that was always what I was going to do. But I'm very happy with my career choice and really happy with what I'm doing.
Nice. Well, as you were, going from, being a doctor, and that's actually kind of similar, to some of my story too, as a physical therapist is, at least when I was in high school, I was like, okay, you go through some sort of, career counseling with the guidance counselor. And I remember taking some sort of test or something that, shows you what you're going to be good at. And I was like, I was going through some physical therapy for myself at the time. And I was like, man, this could be a cool job. And I just kind of kept on that path.
Stuck with it.
Yeah. So it sounds like you kind of had a similar journey, if you will.
I really did. So University of South Florida, where I graduated, they offered kind of an accelerated medical school program. It was a 7-year program. And so actually in high school, I actually went through the whole ringer of kind of going into medical school, kind of going through the interviews and things like that and getting accepted from high school. So it was kind of a preordained thing even through undergrad. So yeah, very similar story. I kind of always thought I was going to be a physician, and that's what ended up happening.
Wow. So you said you were accepted into medical school when you were in high school?
Yes. As long as you hit these kind of criteria throughout undergrad, you're automatically accepted into medical school. And that's kind of what I did.
What drew you into, maybe just generally speaking, like medicine? You said that you kind of had this, from a very young age, you knew you were going to be a doctor.
I think playing with doctor's toys was my favorite thing to do. My mom would tell you that from 6 months old, that was kind of my thing. And so I kind of stuck with it, and everybody told me you're going to be a doctor. And I think it became kind of a self-fulfilling prophecy.
I know you have some, medical profession. You were telling me beforehand that your parents own therapy, a rehab, a pediatric rehab. Or are there other kind of medical professionals kind of in your sphere?
My mom was a mental health counselor. My brother is a pharmacist. My sister is actually a CRNA, but I'm the actual first physician. So
okay.
I guess we're all kind of medical, but not a lot of doctors.
Nice. That's similar to my story. I got a lot of dentistry on my side. My father and brother, and sister is a hygienist, and sister that's a counselor, and I'm a physical therapist. So it sounds similar in that regards of some interest in health generally.
Yeah,
like over with the family. So you kind of knew that you wanted to, attracted to being, a doctor. And then when it came to, getting, closer of age where you're making like decisions, how did that process kind of go for you as far as medical doctors? There's all different, directions you can go with something like that.
I wanted to go into medicine, and I actually didn't know what I wanted to do in medicine. And so I was accepted, and I always thought that I was going to go into kind of just being a general practitioner. I thought that was where my future was going to go. And the way that medical school is structured, you do these rotations, right? Mm-hmm. And my last rotation I decided was actually my surgical rotation. And I didn't know I was going to do surgery. I thought I was going to do medicine. So I ended up loving surgery as my final rotation. I had to kind of scramble into something that was both medicine as well as surgery. And ENT is a really nice mix of both of those. And that's kind of what led me down this route.
Is the surgical rotation, I've never been through medical school. So is that they have kind of everybody go through a surgical rotation?
Mm-hmm. So in medical school, you have to go through kind of programmed rotations. And normally it's medicine, which is like internal medicine, kind of hospitalist stuff, general surgery, where you do kind of 3 months of general surgery, OBGYN, psych, and kind of all like the normal stuff. And then you're supposed to decide what you want to do. But most medical students have kind of decided by then. It's more difficult the later you decide because you kind of have to do research and do all this stuff to get into your desired field.
So you kind of, it sounds like you were heading one direction, then like, they kind of flipped a bit there at the end.
Exactly right. It was quite a scramble, but it ended up working out, and I'm very happy with it.
Nice. So surgery. So you had a strong interest in surgery. I imagine many people maybe would have an opposite reaction to wanting to do surgery. What is it? Yeah. What is it about surgery that really drew you in?
I like working with my hands, but more importantly, chronic illness is difficult to treat. As a primary care provider, you're treating a lot of chronic illness. And a lot of times you're giving a blood pressure medication or you're giving a diabetic medication, and it can take months, years to kind of see the results of that. And the nice thing about surgery is a lot of times you go in, you fix something, and the patient's better. And so the immediate gratification of that was kind of what kind of drew me in that. You can actually go in and fix things right away.
Yeah.
In medicine, you just don't get that satisfaction.
Sure. Yeah. And I know, you were sharing right before we started recording about even a case that you had surgery of this morning. And, I could see, I don't know if you want to explain a little bit about it. You're removing a voice box for somebody who had cancer, right?
Yeah.
And just even witness, like I could see, like you were telling us that, that they, checked the pathology and it was clear, the margins were clear. And, you could just see the excitement on your face. And I'd imagine that's a lot of that experience is something that you get in surgery like
yeah,
that.
It's actually a lot of fun to do those types of surgeries, like removing a voice box. And then it's more fulfilling when you find out that the pathology is all negative and
Sure.
you know that this patient is no longer going to have cancer. It does make you feel a lot better.
Yeah. So we're kind of progressing along, like your kind of journey into medicine and medical school, and then you develop a real strong interest like with surgery, and that's still a pretty broad category, right? So kind of take us kind of through that even development into like ENT specific.
So I spoke earlier about how I thought I wanted to go into medicine. I wanted to be kind of like a primary care provider. I do like the interactions I have with patients.
Mm-hmm.
General surgery, you don't have a lot of interactions with patients. Come into the hospital with your gallbladder, it needs to be taken out, and the surgeon takes it out, and then you go about your way. Well, with ear, nose, and throat, we're a combination of both clinic and surgery. So I'm able to kind of see patients in clinic. I medically manage a lot of patients. In fact, I like medically managing patients as well. But, sometimes medical management fails and we talk about doing surgery, and we can go that route as well. So
Sure.
I really like the aspect of having both medical and surgery. And that was kind of something that ENT offered me.
Nice. So you went through your residency in Illinois, and now you're in Knoxville. So tell us a little bit of how you ended up in Knoxville.
So I always knew I wanted to move to this area. My brother lives in Sylva, North Carolina. It's about 45 miles from here as the crow flies, but it's about an hour and a half long drive because you got to drive kind of all around the mountains. We looked at Asheville, North Carolina, and there just weren't a lot of viable jobs there. And then we looked here in Knoxville, and there was a really nice practice that I really appreciated. So we decided to kind of interview here. We fell in love with the practice, fell in love with the city, and we really like it.
Yeah. What's the name of the practice?
It's Greater Knoxville Ear, Nose, and Throat.
Okay. All right. So with all you guys listening, check them out there. I believe it's maybe the largest group of ENT physicians.
We are the largest group of ENT physicians in town. We're based really out of University of Tennessee Medical Center, as well as kind of North Knoxville.
Okay. But it's not necessarily considered like UT ENT.
We are the UT ENT group. So there is no UT ENT.
Okay.
It is us.
Gotcha.
So we don't have UT on our name, but if you go to UT and get an ENT doctor, it will be a Greater Knoxville ear, nose, and throat doctor.
Okay. Awesome. Well, yeah. Well, thanks for sharing. I know we are going to take a quick break. And then when we come back, we are going to talk specifically about sleep apnea. It's one of Dr. White's specialties. And so we're going to get deep into the topic of sleep apnea.
All right. Appreciate it.
Stay Healthy Knoxville is sponsored by Simply Physio, a physio clinic that equips and empowers you to live your life to the fullest so that you can enjoy the things you love to do and be the person you are made to be. Simply Physio specializes in helping people get back to a healthy and active lifestyle, living free from pain and medication and avoiding unnecessary surgery. Stay tuned until the end of the episode to receive a special gift from Simply Physio and enjoy listening to the rest of the episode.
All right, well, guys, welcome back to Stay Healthy Knoxville. I'm here with Dr. Joe White, local ENT, and we're getting into the topic of sleep apnea. And we were talking before the break about how your group has the largest number of ENT physicians, but how you guys don't all practice to do the same thing, right? And starting to develop just niches, subspecialties. And so sleep apnea is one of yours, correct?
Yes.
Awesome. Well, yeah. How did you get into even sleep apnea as far as that niche, if you will?
So when I was in residency, we did do sleep apnea surgery, but it wasn't something that I kind of grabbed onto. You know, what happened was I came here to Knoxville, and one of my partners, Alan Rosenbaum, actually was undergoing training, or was going to a training service for a new sleep apnea surgery. And this was, which we'll talk about later, which is called that hypoglossal nerve stimulator. And he kind of just casually asked me if I wanted to come along. And so I kind of got coattailed into this, and we went and I got trained with this. And ever since then, I've been kind of focusing on sleep apnea more and more, and kind of dedicating more of my practice to it. So I think I have Alan Rosenbaum to thank for kind of bringing me along on this.
Awesome.
So I appreciate that.
Yeah. And then, and I was doing a little bit of research just about sleep apnea before the podcast. And, you know, one surprising statistic you could maybe tell more is just how prevalent it is, or maybe even underdiagnosed it is.
Definitely. There's studies out there that think that 30 or 40% of the population potentially have sleep apnea, and maybe even more with the obesity rates that we have here in the United States.
Sure. What is sleep apnea? Tell us maybe a little bit more there, and then we can get into the treatment options.
So let's start talking about sleep apnea. So what obstructive sleep apnea really is, actually what sleep apnea is there's kind of two types of sleep apnea. There's obstructive sleep apnea and central sleep apnea. And obstructive sleep apnea occurs, and that's the one we're going to talk about the most because it's the most common. But that occurs is what happens is when we go to sleep and we get to the deeper levels of sleep, you know, it's normal for the brain to kind of relax the muscles in our body. And as you relax the muscles in our body, it causes them to collapse inward. And as they collapse inward, you can't get as much air from your mouth to your lungs. And so a whole bunch of things start happening. So if you can't get as much oxygen to your lungs, the amount of oxygen in your blood starts dropping. Your heart has to start pumping harder to kind of increase the oxygen to the brain. But eventually what happens is your brain says, hey, I'm not getting enough oxygen, and kind of wakes your body up. It arouses you. So most people who suffer sleep apnea, you're going to have them kind of say that, you know, they'll kind of wake up out of breath, or sometimes they'll kind of just wake up and not get to the deeper levels of sleep that they need. But what this does is it makes it so that these people who suffer sleep apnea never get a good night's sleep. You know, they're always kind of falling out of deep sleep and going into lesser sleep. And so they're always tired. There is another type of sleep apnea called central sleep apnea. This is kind of occurs when the brain kind of forgets to tell the body to breathe, but it's caused by a whole different host of things. And we're not really going to talk about that today.
Okay. You said that's not near as common.
Not near as common
as obstructive sleep apnea.
Exactly right.
So I'd imagine that maybe some difficulty with sleep apnea is it occurs when you're sleeping. So there's not as much conscious awareness of what's going on. So it has to be diagnosed based off of maybe symptoms that people are having? Exactly right.
So people who have sleep apnea, most of them don't know that they have sleep apnea. They'll kind of just tell you that they have a bunch of symptoms. And most of those symptoms will be kind of, I'm tired all the time. You know, I sit in a chair and I fall asleep right away. I'm constantly fatigued. I'm irritable. And these symptoms they've had for a very long time, and they've probably had a huge workup for fatigue. You know, they've had every lab work and they've had everything. But really what's happening is they're just not getting a good night's sleep. And so that's what's causing most of their medical issues.
Sure. And are there other things that I'm sure there are that you look for or it would maybe predispose somebody towards sleep apnea?
Yeah. So one thing we've kind of already touched on, but being overweight is a risk factor for sleep apnea. One of the biggest risk factors is actually kind of the circumference of your neck. So having a thicker neck, shorter neck makes you a higher risk. And also when you kind of look in their mouth, if they have a big tongue or something back there that's kind of blocking the airway, big tonsils. If you have big tonsils, that can predispose you to sleep apnea as well. In children, big tonsils is the number one reason why they have sleep apnea. So you take out the tonsils, it fixes the problem. So yeah, there are some things that certainly predispose people to sleep apnea.
I didn't even think about even children.
Yeah.
Is that something that you see frequently, or is the tonsillectomy kind of the main treatment for it?
Exactly right. So as an ENT, we actually treat a lot of pediatric obstructive sleep apnea, and it's fairly common. There was a recent study that came out a few years ago that looked at patients that had been treated for ADHD, and they were on medication, and they found that their symptoms actually improved after taking out their tonsils. And so, what that means is that children who have sleep apnea, they're not getting a good night's sleep. They're tired, they're fatigued, they may be more irritable, but they also have less attention span. And because they have less attention span, they're more likely to get a diagnosis of, let's say, ADHD. I'm not saying all ADHD is caused by sleep apnea, but there are certainly some cases out there. And that would be something as a parent that I would look at if a child did have ADHD and they had big tonsils and they're snoring and they have possible apneic episodes where they're kind of stopping breathing. I think getting a tonsillectomy or at least being evaluated would be a reasonable option.
Yeah. So for children, that's the main treatment.
Exactly right.
Is a tonsillectomy.
Tonsillectomy is the main treatment for sleep apnea in children, and it works most of the time. Now that there are more obese children, though, there are more children going on CPAP after they've had their tonsils removed.
Okay.
And that's just because they have the same pathophysiology as kind of what an adult would have.
Sure. So, and you mentioned that weight, is a large contributing factor as well with sleep apnea. But even somebody can have a large gut, belly, but they may not have it in their neck. So it's really particularly like the neck.
It's the neck circumference, and you can imagine that if your airway is kind of stretched out, and you have all these muscles, because everybody has the same organs, the same muscles in there.
Yeah.
So if your neck is really stretched out, you have a long skinny neck, things just don't have a way to collapse in there. But if everything's kind of piled on top of each other, things can collapse and cause more obstruction in the airway. So yeah.
Sure. And then if sleep apnea goes untreated, what are the consequences or the ramifications?
So there's a lot of kind of long-term risk factors for untreated sleep apnea. It's been correlated with increased coronary artery disease, increased hypertension, so higher blood pressure, increased pulmonary disease. It's also been correlated to kind of in more obscure rates, kind of more mental health problems and things like that, just because you're not getting the sleep that you would have otherwise.
Yeah. Yeah. Imagine, sleep, we talk about with our patients kind of like the pillars of health, right? And one of them is sleep, right?
Just having a good night's sleep changes everything.
Yeah. It's such a huge, piece that you're getting quality and the right quantity, but also quality.
Quality is very important. Yeah.
So we just talked about if it goes like untreated, and a few other things you'd mentioned already as far as higher risk for like hypertension.
Mm-hmm.
And one of the questions that I was looking at when I was doing some research was, can sleep apnea cause hypertension, or is it kind of vice versa? While we're on that topic.
So I think if you were predisposed to having hypertension, I think having sleep apnea will make that worse. I don't know the correlation actually of those two things.
Sure. But I guess you were explaining earlier that if you're not getting good breath and you're having difficulty breathing because of some obstruction when you're sleeping, that it can even force the heart to work harder.
So the heart is going to have to beat harder to provide your brain with more oxygen. So that's going to elevate your heart rate, which ultimately will elevate your blood pressure as well. So it will predispose you to that. The other thing it can cause is something called atrial fibrillation in some patients too, is by causing your heart rate to elevate, it can kind of it can be a risk factor for AFib as well. So many medical problems coming from sleep apnea.
Sure. So, as listeners out there listening to this and maybe suspecting like, hey, I don't get good sleep. I wake up, in the morning and I've been in bed for, 8 hours, just a decent amount of time, and I'm having fatigue and these other things. So what would you advise somebody who's maybe wondering, if they do, like what's kind of the next step?
So there's only one way to diagnose sleep apnea at this point in time, and that way is with a sleep study. And so there's really two types of sleep studies that we use. The first one is the most accurate. It's called the in-lab sleep study, and you have to go to a sleep doctor to do one of those. I do sleep surgery, but I do not do sleep medicine. I know that's a weird thing to understand. So there are certain doctors who just do sleep medicine, and they do sleep studies, and they do kind of all the intricate, complicated things of sleep medicine. They're kind of like the brains of sleep, and I'm kind of like the technician. I'm the technician of sleep, where I kind of help out kind of from the surgical front. But going to the sleep doctor, they will order a sleep study, which you will either do in lab or at home. And sometimes at home can be a nice screening sleep study to kind of tell if you have sleep apnea. And then maybe you'll move on to getting an in-lab sleep study to kind of get the finer how severe it is and kind of what we can do from there.
Sure. So that would be kind of that first step is usually ending up with kind of talking with a sleep doctor.
Yep.
And then I'd imagine if that's not working, that's usually when surgery is indicated, right?
Exactly.
Okay.
So the sleep doctor, which I think is probably part of your next question, is how do they treat it? So the standard of treatment is something called CPAP. I think everybody knows about continuous positive airway pressure. There's a couple of different types of PAP: CPAP, VPAP, variable PAP, or BiPAP. This is where it kind of breathes in and out for you. But the point is that we talked about earlier that your throat is collapsing down when you're sleeping at night. And so CPAP, or continuous positive airway pressure, blows air into your mouth, into your throat, kind of balloons the whole thing open. So air is able to move from your mouth to your lungs again. And it is curative if it does work, if it functions well.
I don't know if this is a question that you can answer or not, but as a therapist, because we talk a lot about sleep positions.
Mm-hmm.
And, more for like dealing with neck pain or back pain. But is there a better sleep position?
That's an excellent question. So whenever you have a sleep study, they'll actually move you around and see where your sleep apnea is whether it's on your side, whether it's supine, laying flat.
Okay.
And so you'll find that most people, if they're completely flat, their sleep apnea is going to be worse than when they're on their side, mainly because we haven't really talked about it, but your tongue is fairly large and it's a big muscle. And it likes to fall back and obstruct your airway. Yeah. So if you think about how can we move the tongue, laying on your side is better. If you sleep standing up, it's better. Gravity will force the tongue down as opposed to back.
Yeah. Or some sort of maybe an incline a bit.
An ankle. And so you can actually see that on sleep studies. When you get a sleep study, it's really we kind of look at how many apneic episodes and hypopneic or half apneic episodes that you have throughout the night. And, they'll measure it in supine. They'll measure it in these different positions. And you can see kind of, and sometimes the sleep doctor will say, well, just sleep like this and you should be okay.
Yeah. Awesome. So yeah, we kind of talked about the more conservative management with some sort of breathing apparatus, right? To assist you at night. And then when that doesn't work, I guess, why would that not work?
Yeah. So about 70, there's a lot of studies that look at this, but somewhere between 50 and 70% of the population tolerate CPAP and love it.
Mm-hmm.
Almost everybody knows somebody who went to a sleep doctor, got diagnosed with sleep apnea, took home the machine, tried it the first night and fell in love. It's the first time they've gotten sleep. They have more energy. They're very happy. And that's great. If CPAP works, I totally recommend CPAP. That's my recommended treatment for sleep apnea. CPAP is the best treatment.
Mm-hmm.
But about 20% of the population, it just doesn't work. Sometimes you get claustrophobic. You can't have it on your face. Sometimes you remove it right when you start sleeping. You're an active sleeper. You move around a lot. And so it's just not going to be something that works for you. And so that's the population where sleep apnea surgery or other options come into play. And there are some other options besides CPAP. One of which is you can go to a dentist, and a dentist can give a kind of an oral appliance that's approved for mild sleep apnea. That can help about 5 to 7 points on your AHI, but it's not going to help moderate to severe sleep apnea. So those people are really looking at surgery.
Sure. So we're kind of getting into your bread and butter, right?
Yes.
So tell us a little bit more, like when it comes to surgery, somebody's gone through the steps and still not sleeping and just, failed the other measures. So then the office talking with you, and are there still decisions to be made?
Yes, definitely. So we've kind of have a lot to talk about. I always tell patients that historically sleep apnea surgery, it's really changed over the last 5 years. And that's because of the surgery that we're going to talk about here today, mostly, which is the hypoglossal nerve stimulator. Historically, sleep apnea surgery really involved removing tissue from the throat and kind of opening the airway like that. And they found that, you could remove a lot of tissue. So you don't have as much tissue in there. It's very painful surgery. But they found that over 5 years or so, that sleep apnea tended to come back,
Just the tissue would come back.
Tissue would come back, people gain more weight or whatever it is. But over time, the data seems to show that, despite having this surgery, that things would come back. So there's a whole bunch of sleep apnea surgeries that we used to do a lot of that we don't do as much anymore just because they don't work as well. There are some other things that we do that I evaluate you when you come in. So if you come in with sleep apnea and you're non-tolerant to CPAP, I will take a look at your airway. Okay. So I'll look at kind of how things collapse, what things looks like with you awake. I'll even take another look at your airway with you asleep. I know that's a little bit more difficult, but I actually have you take you to the operating room and we give you some medicine to make you sleep. And then I pass the scope in your nose and kind of look at your collapse pattern just to see if you're a candidate for the hypoglossal nerve stimulator or see if you're a candidate for anything else. And so that's part of the workup for the hypoglossal nerve stimulator is undergoing that drug-induced sleep endoscopy is what it's called. One other thing that's important to note is that for a portion of the population, they don't tolerate the CPAP because a large portion of wearing CPAP is having it blow air through your nose. And some people have too much what's called nasal resistance, meaning that if you have nasal obstruction, that can also make it difficult to tolerate your CPAP. So by fixing a septum or straightening the septum or opening up your nasal passageways, you can also improve the breathing that way.
And then get back to the CPAP.
Yeah. So that's always, I always tell every patient that, not everybody wants a stimulator put in their body. We can still try to work you and try to get you to tolerate CPAP. And so if that's an option, I always try to do that.
Right. So you kind of briefly mentioned the hypoglossal nerve stimulation. So that's the surgery. I guess we want to get into a little bit more detail of like, what is that? And you mentioned a stimulator.
Yeah.
So tell us a little bit more about that procedure or technique, treatment option.
So I talked about earlier how old sleep apnea surgery was all about removing tissue and kind of opening the airway. Well, I like to kind of explain hypoglossal nerve stimulator or upper airway stimulation as trying to replicate what your airway is like when you're awake. When you're awake, you're breathing fine. You have no trouble getting air from your mouth to your lungs. But the second you fall asleep, those muscles, they relax, they paralyze. So if you can add tone back to those muscles and allow them to move, that can open the airway. And that's kind of the idea behind the hypoglossal nerve stimulator. So the hypoglossal nerve is the nerve that goes to the tongue. It controls protrusion of the tongue. And we know that the tongue is the largest muscle that collapses. It's responsible for almost 90% of patients' sleep apnea when it collapses backwards. And so we know that if we were to put an electrode, this is a surgery where we install a pacemaker-like electrode into the chest, and we tunnel a wire all the way up to the tongue base, and we put it on the hypoglossal nerve. The electrode the device also has a sensor where it can detect every time you take a breath. And so we know that if you can detect the breath and then you cause the tongue to stimulate and protrude out, it can pull the airway open, opening your airway, allowing air to move from, as I said, your mouth to your lungs, and kind of fixing the problem in about 70 to 80% of patients.
Wow. And so it's able to detect when you're asleep?
So it does not detect when you're asleep. It has a timer on it, a latency period where you're asleep. But most people who have it, they don't really notice it's even on when it is on.
So when you say late, like how does it know to activate? I would be like, is this thing gonna start busting at me like when I'm asleep, forcing my tongue to do weird things?
So basically, you put a timer on it. That's how it kind of works right now.
Okay, so like when you're going to bed, say like, hey, I usually fall asleep within this amount of time,
and that time is the same for almost everybody.
Okay,
it's every single night.
Okay,
yeah, it's consistent per patient, not the same for everybody.
Right, because my wife had me, I'll fall asleep like that. When I think last night we were reading the kids a story and I was almost asleep. I was doing the wrong one reading too. My wife had the opposite sleep kind of stuff, getting to sleep. So kind of getting back. So you would just set that, you would turn, or I guess have it set so and hit it like an on switch.
So it has a remote control.
Okay.
Yeah, and it has a remote control that you can set a timer to. The newer ones are going to have an app, they're Bluetooth, but not everybody has those ones yet.
Yeah.
But yeah, so you have a remote control, you turn it on, and then you fall asleep, and then it detects every time you take a breath, every time you breathe, pulls your tongue out, which pulls your whole airway open, getting a nice solid breath in.
And then you just turn off when you wake up.
Most of the time, you have a timer on that as well.
Okay.
So then you don't
8
really
hours,
notice
7
it.
hours.
And with all honesty, I've had patients tell me that, they'll get up in the middle of the night and forget about it, and then they don't even notice it. So it's very well tolerable. Like it's amazing how much humans can get used to things.
Yeah, it's not like you're getting shocked by electric fence or something.
Exactly. No, yeah, you can't really feel that. So yeah.
Nice. Well, and you said this is a relatively recent advancement in the medical field.
Exactly. So this started all. The initial trials were from 2010 to 2014. It's called the STAR trial. That's where they came out with all this data that we're talking about here. And so, and then up until 2018, really you had to go to a huge center if you wanted this. And only now, up until is it really available in smaller cities like Knoxville. There's 3 surgeons in Knoxville who do it. So, and all of them are good.
Yeah. And then you said, I don't know if you said on the recording or not, but Inspire is kind of a name that people may know by. Or?
It's the hypoglossal nerve stimulator is done by Inspire. That's the company that makes the device, that makes the pacemaker, and they're responsible they're the only vendor of this in the United States. So yeah, so Inspire is the kind of the brand name.
Okay, awesome. Well, yeah, that's a lot of great information. And I'm sure just as, listeners are, listening to this that are interested in the topic to kind of go from, point A to, I guess, understanding about the issue to understanding kind of where along the path they may fall, if you will.
Yeah.
And having an appreciation for kind of all the different options with that too is kind of wrapping up the hypoglossal nerve stimulation. Is there anything else that people ask about or that would be important to kind of cover as well?
I just wanted to kind of say how impressed I have been with the hypoglossal nerve stimulator and with Inspire. I've done sleep apnea surgery for like 6 or 7 years, and the patients I get that have been activated with the Inspire are some of the happiest patients I've ever had. I had a patient about a week ago who told me that she honestly told me this, that she told me that if she would have gotten the hypoglossal nerve stimulator 20 years ago, she says she feels like she would be a successful person nowadays. Because for the first time in her life, she feels like she can get up, she can do things, she can be active, because she's had untreated sleep apnea for 20 years that CPAP wasn't working. And now she feels like a new person. So it's quite rewarding to hear that from a patient. And so it is impressive. I've seen people with severe sleep apnea go to normal, and they are just living totally different lives before and after. So it's been a good journey for me as well to kind of see that.
As you mentioned that too, I just had another question. Like, is the unit itself, does that last
10 years?
10 years. Okay.
Yeah,
and then you just have to do a replacement or
just a little battery replacement. It takes 15 minutes.
Okay. So not too bad.
Yeah.
Well, awesome. Well, yeah, thanks for sharing. Wanted to transition. We love to finish the podcast with some questions I ask all my guests that have a Knoxville flavor to it. So the first one is, tell us something, Dr. White, something that's on your bucket list to do around the area, Knoxville, Greater East Tennessee kind of area, that's been on your bucket list.
I want to go to the Dolly Parton, I guess the Dixie Stampede.
Okay.
I've never done it.
Yes.
I also wanted to do, there's a trail in the Smoky Mountains called Gregory's Bald. You can only do it in June. I guess it's June or late May, where they have the fire azaleas.
Yeah.
I've been wanting to do that as well, but I've just never, every time that the bloom is happening, I'm like out of town. So
yeah, I've never seen the blooms. I've been up on that. Have you been on the trail before?
I've only done half the trail, but we went back, but I would love to do the whole thing.
Yeah, it's a hard, I think there's a few different ways you can go up. I've always done it from North Carolina. I don't know if you can get there from Cades Cove.
It's Cades Cove. That's it's like a trail off to the side.
And there's maybe a road at some time that's open. Maybe I think it's a seasonal road that you can get up pretty close to it too. But yeah, that's a beautiful area. And I'll tell you, the Dixie Stampede I went to a long time ago, but the pirate show, they have a new pirate show.
Is that one good?
It is good. Yeah, it's put on by Dolly too and her group. So went I think 2 years ago, and that's a pretty fun show too. Just more acrobatic kind of things versus the Western kind of theme. So
I'll have to check it out.
Yeah. But what's one of your favorite places to go outside around Knoxville? I know you love the outdoors. So if you got a free afternoon or free Saturday, where would you find you outside?
I like hiking. We've already talked about this, but one of my favorite things to do is I like to do House Mountain with my dogs.
Okay.
Because I know it says that off leash is not allowed, but if you go on a weekday, nobody's there.
Yeah.
And I do off leash with the dogs, and they just love it. They're so happy. And so
Nice.
it's, around Knoxville, that's definitely one of my favorite things to
Yeah.
do.
Awesome. I've actually never done House Mountain.
It's great, actually.
Yeah. It's been on one of my bucket list, I guess, is to get out there. Awesome. What about a favorite restaurant, place to go out to eat?
I actually like a place called Asia Kitchen. It's on Kingston Pike. Their twice cooked pork and Szechuan fish is amazing. But I've eaten it, asking me my favorite restaurant, I eat for a living. I do medicine and then I eat.
Okay.
And so that's like, it's a hard question.
Yeah.
What's your favorite band is always a hard question,
Sure.
But time and time again, Asia Kitchen, those two dishes.
That's where you take somebody if they're visiting.
Yes, it's very good.
Yeah. Yeah. Awesome. And then what is your best tip and recommendation for staying healthy? Maybe if we're kind of focusing on the sleep apnea kind of side of things.
So me personally, I hate working out, but the way I get around that is I hike a lot. I paddleboard twice a week. I kayak. I mountain bike. There are other ways of working out, even if you hate working out.
Yeah.
And I think that's also important.
Yeah. Finding the thing that helps to get you up and moving.
Exactly right.
Right. Oh, great. Well, last thing, how can people get in touch with you if they, want to pursue or figure out some sleep apnea type of stuff?
Yeah, so you can get in touch with me for sleep apnea. The Inspire website is actually great. You can connect to me there. You can always call my office at 521-8050 and get in touch there. It is always recommended, though, that you have a recent sleep study before we even talk about Inspire, because you're going to have one if we're going to go that route.
Sure.
All right.
All right. Well, thank you so much for coming on the show. I've learned a whole lot about sleep apnea, so I appreciate you coming on, Dr. White.
All right. Thank you so much. I appreciate it.
Yeah. Stay healthy, Knoxville.
Thank you for tuning in to the Stay Healthy Knoxville podcast, brought to you by Simply Physio. If your pain is preventing you from staying healthy and active, and you'd like to avoid surgery, pain medicine, or just want to get back to doing the things you love in and around Knoxville, we offer both a free ebook and free over-the-phone consultation to help you figure out the root cause of your pain and the next best steps for resolving it. Find our ebooks online at simplypt.com/health-tips. There you will find ebooks for topics such as neck and shoulder pain, lower back and hip pain, knee pain, and TMJ. These quick-to-read reports will provide you with expert tips, tricks, and exercises to help solve your pain from the comfort of your own home. Just visit simplypt.com/health-tips to download your ebook and have it delivered directly to your inbox. We also offer free, no-obligation phone consultations with a doctor of physical therapy to Knoxville area residents. Just call us at 865-351-0615 or visit us at simplypt.com and click the Talk to a PT button on the home page to schedule a call with us. Thanks again for joining us, and we will see you next time on the Stay Healthy Knoxville podcast.